Okay. Thank you guys so much for coming. I wanted to maybe give people a few minutes, but I think we can just start with introductions and then Dr. Barnert can start talking and people might trickle in. Thank you so much for coming to our first neuroscience communication meeting. I'm not going to say too much. I'm going to let Yuki introduce Dr. Barnert, but we basically, Yuki and I and Lauren wanted to start this affinity group just because we're all doing research and we're all interested in how to communicate that research to the public, to like general society, as well as to policymakers. And I think there's such a breadth of research happening here at UCLA, but it's in so many different departments around this idea and people who are communicating with society and with policymakers. So we wanted to kind of bring that community together. So Dr. Barnert is a great first speaker to have because she has had so much success, and I'll let Yuki tell you and then Dr. Barnert tell you about it, but it's really inspiring the way she's been able to translate her research into action and policy. So I'm going to pass it off to Yuki. And also, if anyone has any thoughts or ideas or anything like that for the direction of the group, please reach out to me or Yuki or Lauren. We're really open. We have the speakers scheduled for this quarter, but we're really open to ideas for workshops and seminars, and just let us know if you guys have any ideas. Thanks so much.
Yeah, thanks everyone for coming. I'm really excited to introduce Dr. Barnert. She's an MD and an MPH. She got her medical degree at UCSF and then Masters of Science as well from UC Berkeley, and then her Masters of Public Health from UCLA. She has been born and raised in LA, and she is currently, for a long time, has been working at an LA County Juvenile Hall, where she helps and does research with youth involved in the juvenile justice system, often young women, commercially sexually exploited youth, and then youth undergoing family separation and reunification. And so the really exciting thing about her research and how it's so powerful, and she's also been able to directly connect it to making legislative changes to be able to help people in their lives. And and when I saw Dr. Barnert talk a few years ago, like for the first time, that was like the first time I became really interested in, I guess, like connecting like research outside of the sphere of academia. So yeah, I'm really excited that you all are going to hear her talk. And yeah, thank you so much, Dr. Barnert, for coming.
Thank you so much. It's really a pleasure. Yuki and Zoe, you've done such an amazing thing with the UCLA Science Policy Group. I'm really excited to be a part of it. It's so important right now more than ever. So I guess I'll go ahead and get started. Should I share screen and launch the PowerPoint? Is that?
Yeah, that'd be great. I enabled screen sharing.
Okay, great. Sorry, I don't know why. When I clicked share screen, it wasn't a choice to share the PowerPoint file. Let me see.
I think is it open already on your computer, the PowerPoint file?
Yeah, let me try again. Okay, yeah, I thought it was open. It must have closed. Okay, are you all seeing a PowerPoint file? Okay, wonderful. So I've given this talk a number of times. If you guys will bear with me, in the end, I have a lot of thoughts about why this matters. And what this means for your research. So I'm Liz, I'm a pediatrician on faculty at UCLA in the medical school. As Yuki and Zoe said, I do research mostly focuses on vulnerable youth and kids in the juvenile justice system. And I have a particular interest in how we actually get our research to matter. I'm old enough that when I looked up articles back when I was in undergrad, I actually had to pull them off of the shelves in the library. And some bookshelves, you had to do this wheel thing because they were stacked together. Anyway, so we don't have the dusty journals anymore, but we still really need to work to make sure our research reaches policymakers. I would love interaction. Feel free to chat or to pause me, but I might get kind of passionate and carried away. So feel free to chat it up and talk to each other, or to let me know if you want to talk about something. And I'm going to try to leave time at the end. So I'm going to start first off by just giving you some information about the US juvenile justice system, and then I'm going to tell two policy stories that are designed a little bit to teach you about juvenile justice, but mostly to illustrate for you the process of that we use to link evidence to policy change so that you can start to get ideas about how you might be able to do it. And I'm happy to be contacted at any point about specific things that you might be working on. And then I'm going to end. I've been thinking a lot about why this matters for the world and your role in this. So in terms of why we should care about incarcerated youth, well, first of all, the United States, can you guys see my little arrow? Yeah, so we incarcerate a much greater proportion of kids in the US compared to any other country in the world. So that's the point of this graph. So it's about 800,000 arrests of kids less than 18 in the US per year. 6.6 million adults are under correctional supervision. That is 3% of the US adult population is under correctional supervision. So these are the numbers to describe our epidemic of mass incarceration. And that's why I use the term epidemiology, because this is a major public health issue. So to illustrate, our epidemic of mass incarceration really kicked up in the 1980s. And then the numbers have been going down a little bit for juvenile justice, but they're still way higher than they should be for a healthier society. I'm going to go quickly through this background stuff, but because I know you guys are really smart, we have a lot to talk about, but if you want me to elaborate on anything, let me know. This, though, is worth pausing on. So the disparities are tremendous. This slide shows the lifetime risk of being in prison for adult men. And this doesn't even include jails. This means federal or state prison. And these numbers are from the US Bureau of Justice Statistics. So the lifetime risk of imprisonment for a Black man is 1 in 3. It is 1 in 17 for white men and 1 in 6 for Latino men. These are real numbers. This is really what our US criminal justice system looks like. And this disproportionality is similar for women and it's similar for children as well. 1 in 3 for Black men. In terms of kids in the juvenile justice system, so a lot of youth have been through high levels of trauma. ACEs stand for adverse childhood experiences, which we know affects young people's neurobiology and their endocrine systems, their hormone systems. So this slide shows in blue the ACEs in the general child population, and then in orange the rate of adverse experiences in the juvenile justice. So you see this inverse relationship here. So a lot of the kids in the juvenile justice system really just have high levels of trauma, and maybe there's other ways that we can be meeting their needs. And this is the line of thinking that led to my policy work. Kids in the juvenile justice system have very high rates of medical illness. So 46% have urgent medical needs. And they're actually a pretty healthy population, but they have unattended to needs like dental abscesses, violence-related injuries. So when they show up to juvenile hall, they get care, they see a pediatrician like me, and there is high need. 12% of kids currently locked up are expecting a child, so boys and girls, and at least 70% have at least one psychiatric disorder. This is a girl in solitary confinement. There is evidence that this is a study that I did that I helped build the evidence for, that incarceration of young people has potential long-term negative impacts on their adult health. So this is showing that depression risk goes up the longer people stay are incarcerated for. So that's the very basics of what I wanted you to know about juvenile justice and health. So now I'm going to jump into how I focused on trying to get involved in this. Sorry, there's a bit of noises in the background. So when I was in fellowship, I did fellowship training in what was called the RWJ Clinical Scholars Program. Now it's called the National Clinician Scholars Program. And I interviewed kids in juvenile hall in LA County. This is the juvenile hall in East LA, to try to understand their perspectives on why kids were ending up in jail. This was a study that was published in the American Journal of Public Health. And one of the things that the kids told me is that the reason that girls were ending up in jail as compared to boys was because girls were getting locked up for prostitution. And that was the word that the girls and the boys used. And so this brings us to our first policy story, decriminalization of child victims of sex trafficking. I don't know if any of you had a chance to hear Holly Mitchell speak. She talked about this issue, but we will roll into it. So when I was in fellowship, I did a 1-month policy elective in Sacramento with Dr. Richard Pan. He's a pediatrician. He's the author of our very impactful state vaccine bills. And as I was preparing to go, I thought about how can I bring the voices of the young people from the juvenile hall to Sacramento? And, you know, they told me a lot of things, but that particular nugget about prostitution was actually aligned with a policy window or an opportunity for policy change. So a lot of young people were, a lot of legislators were very interested in this idea of child sex trafficking, which is what we used to call child prostitution, or commercial exploitation of children is another term for it. And there was a lot of interest in passing legislation to protect young people, to protect child victims of sex trafficking. So I thought, oh, this relates to the interviews, to what the kids are telling me. So I pulled a bunch of the quotes, you know, compiled them, brought them to Sacramento. And then when I was in Richard Pan's office, his office said, okay, this is what you want to work on. And his chief of staff walked me downstairs and introduced me to Senator Holly Mitchell's chief of staff. She is an amazing legislator. And at that time, they were contemplating legislation to decriminalize the child victims of the trafficking. So to say, we're not going to put you in jail because you were victimized as a sex trafficking victim. We actually weren't sure if it was a good idea. You know, ethically, as Holly Mitchell says, it makes so much sense. If you're young and you, according to the law, can't consent to sex, then how can you be charged with prostitution when you're a victim? However, you know, there was a lot of pushback. There was concern that kids would lack the safety and the protection of juvenile hall. We have a very paternalistic public health system. So I started calling people in other states that had already done this kind of legislation. Then my 1 month in Sacramento ran out. I came back to UCLA and I launched a policy analysis where I didn't actually have funding for this, but I got IRB approval. I partnered with the Children's Law Center of California, and we called people in states with and without the safe harbor laws to ask them, these kind of decriminalization package of bills, to ask them how it went and what they would recommend for California. And then we did an analysis that was actually geared towards policymakers. We published it in a journal called Child Abuse and Neglect. And then I took hard copies of this manuscript to Sacramento. And so in the manuscript had a table that included provisions of model legislation. So we based our analysis on how to make it most accessible to policymakers. And then I sat down with John Skoglund, who was a staffer in Senator Mitchell's office, and he spent 2 hours with me going over the paper and the results of the table, and we sat in this cafe, and he probably spent so much time with me because I was a researcher and I was not a lobbyist, because he was really trusting me. I really want to emphasize John because John became my buddy. And one of the things that Senator Mitchell said when she talked to the science policy group, you know, she was asked, how would you advise graduate students or postdocs, early career researchers, to get their research to policymakers if they feel like they have idea or relevant input? And her answer was to call the district office. So a lot of people presume that you need to go to the legislator, but I've actually spent very little face-to-face time with Senator Mitchell, and on all this, in this policy story and in the next one, we did not sit down face-to-face. It was always me just working with the people that are the same age as me. It's like very friendly and very easy. It's about relationships and bringing the information. So I want to emphasize that this is very accessible. So what Senator Mitchell explained, you call the district office or you call the office in Sacramento and you say, I have this idea, or I have this research that might be useful, and they will immediately triage you. First, to figure out if your information is relevant to the state legislature versus another level of government or another branch of government. So, oh, this seems like a Los Angeles City issue or LA County, or okay, you know, you might be better served with our Department of Health and Human Services, or okay, this sounds like a state issue. I'm going to have you talk to our public safety person or our health person. So anyway, reach out and then they will direct you appropriately. Okay, so another piece, another aspect of this work, I'd love to spend more time talking about this. I put a lot of thought into this, but the distinction between scientific research dissemination and advocacy, I did both in this process. One of the things I did as an advocate was I authored a resolution for the American Academy of Pediatrics, which represents 66,000 pediatricians, that said the pediatricians should support advocacy for decriminalizing child victims of sex trafficking. And this is what allowed the AAP then to go on record saying, this is a good idea, locking kids up for their victimization is harmful. And then Senator Mitchell could challenge the opposition and say, the pediatricians say we're hurting the kids when we do this. So the opposition, as I already mentioned, was basically this mentality that kids wouldn't get the help that they needed. But we found that if you provide appropriate funding and services, there are alternate, more effective pathways to serve the kids. So Senator Mitchell is a very capable legislator. I was sitting in a research meeting, a pretty boring data crunching research meeting at UCLA when I got this text. It's a screenshot of the vote screen. The vote needed 40 votes to pass the Senate. This is when the bill got the 41st vote. So it's actually very controversial, even though it seems so obvious. It was really hard to pass. And the bill has become a law. It's California Senate Bill 1322, and it says that we no longer lock kids up for their own victimization as child sex trafficking victims. So I learned a lot. I learned, how to integrate this interest of making policy change and doing research. At some point, I'd like to create a graph that shows the relationship between the amount of funding I have on the project and the amount of impact, because I've noticed that it tends to be the smaller unfunded projects that have had more impact. But this is kind of relating to this story I've been weaving for you guys of who really belongs in the juvenile justice system, and maybe there's better ways to help young people, particularly young people who are vulnerable, experience a lot of structural inequality and have high levels of trauma.
Can I ask a question?
Yeah.
So before, when you were talking about how you got the letter from the Association of, is it the APA?
AAP, yep.
AAP. So what was that process like? Was there like a system built in to make that quite efficient for you to reach out to everyone and get this letter? Because that seems like that would be challenging to get the support.
Yeah, so great question, Yuki. So there's two steps. So, professional societies, they do have a process for this. AAP has actually a lobbyist on staff at the state level, and then many at the federal level, or a handful at the federal level. But the American Academy of Pediatrics cannot advocate for something if it's not officially a policy. It's not something that they've taken a stance on in their endorsed policy statements. So for that, there wasn't a stance on it. So that was why we wrote the resolution. And so there was like exact timing, and then it was just preparing a 1.5-page document. And then the AAP voted on it in the leadership meeting. And then once it passed, then I had to tell the AAP lobbyist, okay, Senator Mitchell has a bill, check it out, there's this resolution, so now you can show up to the hearing, and then they kind of took care of it from there. So if your organization already has a stance on something, then you just have to tell, most professional societies will have a government rep. You might actually want to take that role someday, like, it's the PhD or the MD, that's just kind of volunteering, and then many of the larger ones will have staff. But the first step is you have to make sure they're allowed to take the stance based on what their written policies are. So I'll bring up how that works into this. So the second story, are you guys following? Is this pace okay for people? Yeah, okay, awesome. So the second story is this question of minimum age, meaning what is the youngest age a child can be in the juvenile justice system, or what should we do for young children who come to the attention of law enforcement? So to tell this like a story, I was part of a group called the University of California Criminal Justice and Health Consortium. These brilliant leaders founded it through a pilot grant from the UC Office of the President that unfortunately wasn't refunded. But it pulled together for 2 years, it pulled together any UC faculty or trainee that was interested in this intersection of criminal justice and health So they brought us together for a meeting in in San Francisco. And so we're sitting at a round table, and they were so smart because they said, okay, you guys are going to divide up into task forces. So I joined the juvenile justice task forces. And then they said, we actually want you to write a policy brief. And they also had an special issue of a journal that they were editing. So there's an opportunity for policy briefs to get published. And they said, pick any topic you want relevant to criminal justice and health, relevant to Californians. So we were sitting around a round table brainstorming, what should our topic be? And I said, I want people to realize that kids in the juvenile justice system are children. That's really what I learned from doing interviews at Juvenile Hall. These are teenagers. They're teenagers who have hope, and they're teenagers who want to do better. And they're caught in a very difficult and unfair system. So I said, I want people to realize that they're children. And somebody else said, somewhat facetiously, let's abolish the juvenile justice system. And then, we all laughed because that didn't seem possible. And then Laura Abrams, who's at UCLA, who I actually hadn't worked with formally yet, but she and I then worked together a lot, said, well, how about the younger age? Laura was on a sabbatical year and had done this international kind of global comparison of how youth ages and youth is conceptualized across different juvenile justice systems. So there are some countries that actually don't have a juvenile justice system. They treat young people who come to the attention of law enforcement as children who need help. So I pulled out my phone, started Googling. We learned that this idea has a name. The name is called the minimum age of juvenile delinquency jurisdiction. First thing that came up was this map from the National Juvenile Defender Center. And we immediately saw that California did not have a minimum age, and that most states at the time did not have a minimum age. So that means a child of any young age could be in the juvenile justice system. And then the range of minimum ages is 6 to 10 years old. So the two stories I'm telling you actually overlapped in time. And I said to the group, well, I can get this idea to Senator Mitchell's desk. And they looked at me like I was crazy, but that was my goal, because I was actually headed to Sacramento right after Sacramento to take the copies of the Safe Harbor study that I showed you guys, to walk around hard copies and have that meeting with John. And so I started, while I was delivering those copies to people, I said, hey, we just had this idea. What do you think of it? Has anyone tried it? Does it seem like something, your boss would be interested in? And people were very eager, and they started to write down the idea. And I said, okay, wait, hold off. I will be back in 1 year when I have evidence. And so that was exactly what we did. And we launched a research study. The first step was to form a team. So we joined up with the National Center for Youth Law, which is a juvenile justice advocacy organization, and Children's Defense Fund with Michael Harris and Patricia Song, lawyers, because I went to them and I said, we had this idea. Does this make sense? Are you interested? And then we stayed connected to Senator Holly Mitchell. And there was something that Senator Mitchell said when she spoke to you guys last week, which was really important. She said, she believes in community-based policymaking, and one of the ways that researchers can interact with policymakers is not just at the end when you've completed your research, but to help you frame policy relevant questions. So that process that I was just describing to you, are people interested in this idea, was really important, because this told me, okay, this is an area where it makes sense to put academic rigor to figure out the data that we would need. And then the other piece of it is we stayed connected to Senator Mitchell's office, not in a way that biased the research, but in, asking them, what would you need to know? And they pointed us, okay, we need to know exactly what the alternate path is. So if, we say 6-year-olds can't go to juvenile hall anymore, what will you do with that 6-year-old? And so they guided our research question. And then we kind of diverged. And just like I said, back in a year, we academics focused on doing research in partnership with our community partners who were partners in the research process. Does that make sense? Okay, cool. So we did a series of, very scientifically rigorous studies. This was one of them was a study of Ad Health, which is a nationally representative longitudinal database. It was a secondary analysis. And we looked at the relationship between incarceration of children and then health outcomes of adults. And we found that first incarceration at younger ages compared to older young adult ages was associated with the worst health outcomes in adulthood. As an example, we also mirrored what we did for the child sex trafficking decriminalization study, where we called states through a qualitative sampling frame, the 5 largest states, 6 largest states in the US, 3 of them had minimum age laws and 3 of them don't. And we said, tell us what happens when young children come to the attention of law enforcement. What minimum age would you recommend from California? How would this work? And so we launched a policy study. And then really importantly, we also did a data query process where we got data from the California Department of Justice that all Californians are entitled to request and get, which showed the number of children in the juvenile justice system. And to give you an example, this is for the year 2015. So in that year, there were 687, I believe I can't see the corner, but I think I have that number right, kids under 12 referred to the juvenile justice system. There was 1 5-year-old. That 5-year-old was a Black boy from a rural county referred for curfew violation. So what was amazing about this number is when this did become a bill, this was the number that the legislators used to understand the scope of the issue. Otherwise, they didn't have access to the data. We got a very clean data set from the California Department of Justice and then just summarized it, basically. So Senator Holly Mitchell, based on our recommendations, introduced a bill that proposed a minimum age of 12 years old for California's juvenile justice system. We recommended a minimum age of 12 because that aligned with standards in the United Nations Convention on the Rights of the Child, Society of Adolescent Health and Medicine, and American Bar Association. And it just made, in developmental science also, and the fact that kids less than 12 are elementary school age. Senator Mitchell introduced the bill. And the bill passed. Yuki, regarding your previous question about the role of professional societies. So in this case, the American Academy of Pediatrics already had a policy statement on juvenile justice. And the policy statement said that when kids are in the juvenile justice system, all confinement has to be developmentally appropriate. So I basically just emailed the California pediatricians that were serving as the government liaisons, and I said, the AAP policy statement says that confinement has to be developmentally appropriate. It is never developmentally appropriate to have a young child in the juvenile justice system. Therefore, that's consistent with this legislation. Will you guys support it? And then they sent an email to Senator Mitchell and carried on from there. So Governor Brown signed the bill into law in 2018. It was the last package of bills he signed in his career as governor. He kind of saved the hardest for the last. Something I think is worth sharing with you guys is that Laura and I sent him a letter as individuals, as advocates, but compiling all of our research findings on this topic. We did 5 studies and giving him our recommendations. And then when he signed this bill, he signed another bill related to age, and he wrote a signing letter. And in that signing letter, he shared concepts that were in our letter that made me very confident that he actually read our letter when contemplating whether or not he was going to sign this bill. So it's now law. It's amazing. And when I'm in juvenile hall right now, the 12-year-olds seem young. And the great thing is that they seem too young to everybody there. And counties have developed pathways to deal with young children. So part of the bill and the amendment process, it was required that every county develop protocol for how they would handle young kids in conflict with the law. And so this is an example of LA County's protocol. Police officers contact with the child, they figure out how old the kid is. If they're under 12, the default is to send them home and to help them with community-based services unless they're not, there's something else going on like abuse or neglect, or they have a medical need and so forth. So this is just an example of LA County's protocol. Implementation of the legislation in California has actually been going very well. California and Massachusetts were the first 2 states to pass the minimum age of 12. The highest one before that was 10. And something amazing has happened since this bill became law in 2018. So this is an updated map. This is from January 2020. It's actually changed even more, but this shows US juvenile justice minimum age boundaries. So California is a trendsetter, and now there are many states pursuing legislation, and some have already passed legislation to either raise their minimum ages or create new ones. An important thing about this concept is that most states, the ones that did have minimum ages, it's not that they changed their minimum age, it was just that these minimum age thresholds were always in place from the time their juvenile justice system was established in 1905 or whenever, whoever set it up way back when, over 100 years ago. So this is really exciting. There's a lot of momentum. Laura and I are now working on nurturing a national coalition that is taking off. And there's a call that Laura and I are making for a national minimum age of at least 12 for federal legislation to support this, aligned with the United Nations Convention on the Rights of the Child. So that's the story of this particular legislation. The point was for you guys, of course, to think about kids and childhood and the juvenile justice system, but for you also to think about how your research can reach legislators. Just to kind of recap the two stories, it really starts with being based, well, for me in the community, but for you, it might be in your labs, but really grounded in what's really needed. And then interacting with legislators, not even necessarily at the end of the process, but ideally early on, and that happens through relationships. And then taking those extra steps to share your policy relevant findings. There's lots of studies that I do that are not useful for the legislators because I'm also on an academic. I don't bother them with those, but the ones that I think are relevant, I reach out to them. So, I'm a little bit, what is this word? Hesitant because I know this is being recorded, but I have a lot of thoughts, and particularly about where we are in society. And I'd like to share them with you guys. I'm going to be really honest with you guys. I've been doing a lot of thinking, and this is my first time kind of sharing these thoughts. So I'd love to maybe I'll get my thoughts out, and then I'd love to, hear from you guys. But what does this mean? This idea of translating research evidence into policymaking. What does this mean for your research? And very importantly, I've been thinking a lot about why does it matter? Why is this so important for our planet right now? So I've been involved in another legislative process. I was able to replicate this process one more time with legislation that had to do with people's Medicaid health insurance getting cut off when they're incarcerated, and then they leave and they're supposed to go to their substance use treatment, but they don't have their insurance anymore. So anyway, so once you replicate something in science, right, then you try to figure out what's going on, what's the mechanism. So I've been thinking a lot about how to systemize making change, and I've been working with Neda Stari, and Yuki's been involved also. And this is really where the UCLA Science Policy Group sits, is how do we build that policy bridge? How can we make it so that all the graduate students and the young faculty and the old faculty that have been around for a long time, and even the students, know how to have this link, and the legislature, the culture of our legislature and our academic institutions is to naturally, constantly be linking evidence into policymaking in a very efficient, non-biased way. How do we do that? So Neda, the UCLA medical student doing a public policy year, is working on a study on that with me. We interviewed legislators in Sacramento, and I'd love to share the findings with it, or Neda can share them with you when we're done. We found some very important things, and the most important thing probably to tell you guys is that it is possible and it is very important. So now I want to talk about why it's so important. So a couple of kind of big picture things I've realized. It's really important to be informed and understand the roots of the problem. So my involvement in the juvenile justice system, I started with first as a clinician and then as a researcher talking to the kids in juvenile hall saying, tell me what's going on from your perspective. But there are a lot of structural barriers in play, structural racism. And so it's going to seem like this is a commercial for Netflix, but there are a couple of things that I would recommend are worth watching. If you haven't seen 13th, I think it's worth it for every American to watch it, but it will kind of, sorry about this lighting, I just saw myself. The roots of the problems of the criminal justice system, and if you prefer to read, this would be the book to read, The New Jim Crow by Michelle Alexander. Very, very powerful documentary. But this is even bigger than just our problem of mass incarceration, which, as I showed you, is a huge problem. So I remember thinking this when I was in college. Knowledge is power, and it's, you know, maybe one of the most important tools that we have. And that kind of passion and that kind of sense of activism is really coming back to me as we're in these challenges of today. So another film that I saw on Netflix that I really recommend you watch is called The Social Dilemma. Feel free to put a little thumbs up thing if you've seen it. But basically what the film is about is how we are all hooked on our social media. And because of it, it's not only is it causing, you know, mental health problems in our teenagers as an example, but really importantly, we are losing tools for discerning truth. People do not know what truth is. So if you Google in a red state and you Google in a blue state, is climate change, you know, Google will pop up, is climate change real, or is climate change a hoax? And people are increasingly getting this divergent view of reality. I think Kellyanne Conway's, you know, famous statement, alternate facts. It's people are living in different versions of reality, but there's not different versions of truth, right? There's one truth, and most people in society, probably in the US society, probably are not as intelligent as you guys also, and people are getting in their bubbles, and we are losing the ability to understand truth. It is very hard to have a democracy and a fair election when that is going on. And on top of that, mental health crises for adolescents and even younger children. Does that make sense? Okay. So at the same time, here's the next film that I really recommend you watch. It's on Netflix. It's by David Attenborough. It's called A Life on Our Planet. And he's a 93-year-old scientist. He's a naturalist, and he calls it his witness statement as he's seen the planet transition in the course of his lifetime. And it's really about climate change and the existential threats that our planet is facing. It's not our planet, right? Because nature will prevail. It's humanity. It's the ability of human beings to exist on the planet. You know, and the species that we will probably endanger before then. And really, really importantly about this film is that it gives hope and it offers solutions. And those solutions, you know, are from science, and they're from improving our quality of life. And we are at a moment, this is why I'm going on a tangent, because there really is a threat to humanity, and we all need to shift our lifestyles, but particularly our academic work and our science to help guide humanity towards sustainability. So I watched this film with my son. Sorry, this is a picture of my two kids. He's 6 years old, and he watched it with me, and there's a bunch of predictions about what the planet is going to look like right before the hope section. We watched it last week, and then yesterday I was asking my son if he wanted pasta for dinner, and he said, yeah, but Mommy, could I have the Parmesan cheese that I had when we were watching the film about that when I'm 60, there won't be enough food on Earth anymore? So this is really, we are fighting for our children's children to be able to live on Earth and to thrive. I'm still a juvenile justice researcher. I still care about linking policy to action, and this all feeds into the importance of humanity in preserving our quality of life and in preserving the planet. So we need to focus on sustainable goals in everything that we do and our link to policymaking. So I'm going to take this one step further, and thank you guys for going with me on this thought journey. So, solution: people can't discern truth and we are in an existential crisis. The solution is science and universities. It's a part of a solution, right? We need to, you know, as David Attenborough says, change fishing practices and diet and all that, but a big part of the solution is science and universities. So the mission of universities is truth. The motto of the University of California is let there be light. Science is a tool to help people get to truth. We have lost the ability to discern truth as a society as a whole. It is very, very important that academics stay grounded in that ability to know truth, and then we share our groundedness and our insights with society. And the link to policymaking is a critical aspect of that. So this is the most recent Netflix film I saw. I also recommend that you guys watch this. It's called Saving Capitalism, and it's the work of Bob Reach. These are all really important things that I recommend watching. I know you're all busy, but I don't really like money that much, so I didn't really pay that much attention to, you know, anyway. But basically, what he explains in a very powerful way is the corruption in politics. So in my work in policymaking, you know, John and I from Holly Mitchell's office would joke. I'd say, I don't know policymaking except that you, the policy, the ideas, you don't have to get into the politics. And that is our role as scientists, is to stay out of the politics. But what is happening in US politics, there's a mechanism for the corruption. And the mechanism is corporate interests. And as corporate interests get more and more powerful, they feed more money, particularly into our federal legislature, and then that they're buying the influence of politicians, and when they do that, then they get the decisions that they want that widen the gap, this gigantic gap between the rich and the poor, which has led to the populism of this kind of hatred that we're seeing in our country right now. And then those same corporate interests get more power. They get political power because they bought themselves part of a seat at the table. And so it's a vicious cycle. So that's how this is described in the movie. So anyway, I should probably say, like, all of these views are my own, but really been thinking about this a lot. What does this have to do with linking evidence to policymaking? And why did I tell you this right after kind of this talk about climate change? It is because we must overcome this, because our threats are existential, but there is a way to do it, and science is part of the path. So what I've come to realize, and what I've really been thinking a lot about, is that big part of the solution is that evidence purifies policymaking. So this is, you know, our scientific method. It's a step to get to the right answer, right? To the best answer. One of the reasons to share our scientific evidence as policymakers is because we get good answers. We start with good questions. We get good information, good data, we boil it down, we reach conclusions. We want to give our policymakers the best of the information. Think about the pandemic now. What's going to save us from COVID-19? It's public health science, and it's the biomedical research vaccine development working in partnership with the policymakers. And basically, everyone's just sitting around waiting for science to solve this for us. And that is the same thing we need to do with our smaller problems, and the same thing we need to do with our bigger problems. So it will be great for Netta to share our findings when we finish the study, but one of the things we've heard a lot about is this concept of cherry picking. So what evidence do you bring? Because, you know, evidence is who's telling it and why and how do you tell it? But there are unbiased ways to share evidence. So if you take the cherry picking and come up with fair, evidence-based reasons that are not partisan to share policymaking, you purify the process. It's not about dollars, it's not about Republican or Democrat, it's just about getting the truth into policymaking. So that is what I wanted to share with you, and I really would love to hear what you guys are thinking. And I have great optimism for our planet, and honestly, Zoe and Yuki, what you do with the Science Policy Group is very, very inspiring to me, and this generation, all of your attention. I really believe not just in the quality of your research, but the integrity for why you're doing it, and the commitment to actually share it and make it meaningful. So thank you very much.
Thank you so much, Dr. Barnert. That was great. I think now we have time for questions. If anyone, you can raise your little blue hand, or you can just start talking. Yeah, if anyone has questions for Dr. Barnert. I mean, I can ask something to start letting people think. So yeah, I mean, thank you so much. That was so great. And it, I guess my question would be, is there anything that you kind of figured out along the process of trying to engage those people in the government that you wish you had known earlier, that kind of changed your perspective or anything like that?
So I think that I had to learn the proper role of the researcher, and as I kind of alluded to, kind of this difference between advocacy and, you know, being the non-biased scientist sharing your evidence. So I mean, you guys probably aren't surprised that I struggle with that, because I'm so passionate and there is so much injustice. But so there was this really interesting process that happened with the minimum age bill. The idea came up in 2016, and we had our team of community partner lawyers that were working on the bill idea with us. And then Donald Trump got elected in November 2020, and then we had our weekly research meetings. And on our next call, they said, you know, we can't do a bill, because me and Laura, the academics, we were leading the paper writing, and they were leading the bill process, or they would have been when we got to that stage. And they said, we can't do a bill. We have all these things now we need to focus on. Children's Defense Fund, we have to focus on children not getting deported and things like that. And I said, okay, I understand. And then I had a phone call with someone named Samantha Corbin, who is a social justice lobbyist. And Dr. Pan's office had just sent me an email. I was just talking to Samantha. Liz, you and Samantha should connect. So I followed up and I said, hey, Samantha. So it was on my schedule. Right after we got off of this call, I talked to Samantha. And in my mind, there was no more advocacy, nothing happening with the minimum age bill. Then I was talking to Samantha next from Sacramento. I told her what had just happened. And she said, well, you should move forward with this idea anyway, because it's a good idea. And that's what matters. But I didn't have any advocates, and I cared a lot about our community partner relationships, and I didn't want to do the opposite of what they had just told me. And she said, and I'll help you for free. She's a social justice lobbying firm. And so I said, okay. And then Senator Mitchell's office actually reached out to me and said, hey, how about that minimum age idea that you talked to us about a year ago? And I said, okay, fine, here's what we have. But there was actually this gap where there was no advocates behind the bill. And what Samantha had told me was, once somebody took it on, and with Senator Mitchell being such a talented senator, she said the advocates would come on after. But there was these 2 months, January, February 2019, where it was like a one-woman team. And I was organizing the phone calls. We had to actually do the process of writing the language, which is something that the advocacy lawyers do. So I wrote it with my friend, who's a child welfare lawyer, who did the last bill with me. She said she would do it as a favor, so she and I did it. And I'm not good at like organizing conference calls and all that, but it was also, and then it quickly became clear that it was not my appropriate role. And so I had to learn, okay, the advocates then came back on board, and I said, okay, good. I felt by crossing the line where the line was. And I said, great, you guys take over the advocacy. We have 2 more papers to finish writing. So I wish I had known that sooner, but the great thing is I now have clarity on kind of this distinction between advocacy and dissemination.
That does seem like a mistake that you kind of have to learn, like, for yourself, by realizing like I can see like how that would happen. I can imagine like that happening to like me and Zoe. But we will try to heed your advice. I had a question, which, and yeah, I know that there's some in the chat too, and please keep submitting them. Which is that, so it seemed like the conference that you had mentioned that only, you know, had the funding for 2 years across the UC, and then you worked, talked about your work with Laura Abrams, who's part of the public policy department, I believe. There are so many like criminal justice advocates and like professors at UCLA. Like, is there a crosstalk? Has there been like an attempt, or is there a barrier there? Because like you've been able to accomplish so much. I'm wondering, it seems like there is a lot of room like here at UCLA to gather momentum just from other departments. So I'm wondering about that.
Yeah, that's a great, so the reason I mentioned that I didn't work with Laura before was because it took us sitting down together in San Francisco to actually start working. So Laura and I, when we got back to UCLA, we got what was called a transdisciplinary seed grant. It was from the Academic Senate, but it was to fund alliances between North and South Campus at UCLA. So that was, you know, one small mechanism that supported collaboration. But there has not a UCLA-wide way to bring the criminal justice people together or the juvenile justice people. Erica Bath is a juvenile justice researcher, and she got a small grant, like a $10,000 UCLA grant to put us together, but it wasn't sustainable. So it's basically relationships. But it's a big campus, and there are people probably doing juvenile justice work that I don't know, but I try to kind of read the UCLA news, and that's, you know, one example actually was in the UCLA news. They published that a law professor, this was in March, had started a database tracking the number of COVID cases in correctional settings. And I clicked on the link, read the story, emailed the professor, Sharon Dolovich, and I said, that is great that you're doing this. And so it was great to be connected with her. And I think at that point, she might not have been connected to a health person. And then about a week or two later, there was the first death in a prison. And then there was a death of a correctional officer. And I emailed her right away. And I said, I think you should add a column to your spreadsheet to your project where you're tracking death. And she wrote me back and she said, I think you're right. And then maybe in May or so, she published a paper in JAMA in JAMA about premature mortality and COVID. So looking for the threads and the morsels, but there's not a systematic way. And I think you're right that particularly with the challenges that we're facing this next 10, 20 years that are going to be so pivotal, interdisciplinary collaboration is going to be so important.
Thank you. So we had a question from the chat. Someone asked, when did you know that your evidence was ready for policy?
Yeah, that's a good question. So first of all, I want to really make the really important point that I didn't wait until after I had the evidence, right? It was from the beginning. Is this a good idea? Would this idea be useful in Sacramento if we were to develop this out? And then you kind of just know. It's like when you're baking bread. It's like you just know when something is cooked, like just like you know when your article is finished, like this is as good as I'm going to get it. But there's also this kind of intermediate process, as you can like maybe make the analogy of like when you put your fork into the cake to see if it's cooked enough, right? And when you're assessing it at that stage, some of that might involve discussions with legislators. So I would actually go to Sacramento, even just to maintain the relationships when I didn't have policy making to talk about, and maybe this is not something that everybody should do because we would flood the legislature. But I remember having conversations with John where I said, this is what we figured out so far about minimum age. And we kind of talked him through the whole thing. And he said, okay, but this is what we still need to learn. I see a gap in what you figured out. Delineate better for us what that alternate path will be. So part of it is kind of, don't be afraid to go early. At the end stage, I think just trust your instinct. And then it's about relationships, right? So it could be, if you have relationships with people in Sacramento, it could be a text or a phone call. as I've kind of developed relationships, I started going in person to Sacramento less and less. And the last bill, this Medicaid bill that I mentioned that I was involved with, I actually just interacted with them by the telephone. I never went in person. Anyway, so that's the best answer that I can give, but don't be shy, and also feel free to reach out to me or to people in your field, in your exact field, who will probably be able to give you feedback.
Dr. Barnett, thank you so much for your amazing talk. It was really inspiring to listen to you talk about your stories and your journey. And so you say that you now have your sights set on the national minimum age in the juvenile justice system. So I'm really curious, how do you expect the federal mechanisms for getting this legislation passed to differ from the state mechanisms that you've already gone through?
That's a great question. So to be clear, I feel like my role as a researcher is the birth of the idea, is to make people aware. We did these studies, they're available, here they are, this is what they were about. I put them into a one-page brief and to get that out. And then it's great to know where your expertise ends. So Laura and I had one coalition call where we invited people from all over the country to come. We called it a luncheon, which was funny because it was like Zoom and free, but we did it from 12 to 1 Pacific time. And basically, that's the lawyer's job, right? There's people who are in DC who are professional advocates, and on the call, they're like, oh, I don't know if it would come from this funding, whatever bill line. I was like, I don't know, you guys figure it out. I just gave you guys the idea. But in terms of like the big picture, basically for criminal law, it's determined by states. This is why I had to partner with lawyers to figure all this out, because I didn't take anything that resembled law in any of my training. But the federal legislature, the federal law can take kind of a carrots or a stick approach, so they can incentivize. So it's almost the same as having a relationship, a law. Like you can get penalized if you don't do this, or by getting less dollars sent to you. So that's kind of what it would look like, but that's not my job to figure it out. I don't know. I actually don't want to know. Oh, there's another question.
Yeah, I don't know if you have time, but if you do, that would be great. But if not, we understand.
No problem. So Natalie's asking, how often is it necessary to conduct an entirely new study versus writing a policy brief based on reviewing existing literature? So that is a great question. I mean, I think that has to do with knowing where the literature gap is. So in the case of the minimum age work, there was not any studies on this. It was weird. It was like people weren't aware of this. Thank you everybody for joining. Feel free to get off if you have to. So it's kind of the same as science, right? If you know that there's a literature gap and you think that something's policy relevant, then you have to do the research. But you only want to do the research if it's needed, if the information isn't already available. In terms of policy brief on reviewing existing literature, so that's amazing. Article reviews are a great idea, but this idea of summarizing existing evidence and helping link it to what's already there, that immediately makes me think of the Science Policy Fellowship, and that's exactly the kind of skills, like that would be the role of a scientist kind of engaged at that intersection. So if it's not done and it's important, do it. If it's been done, yes, help get the information to the right people.
Amazing. Thank you so much, Dr. Barnert. I think we're going to cut it off here. But yeah, thank you so much for coming. And also for